As the physician recruiter for Meetville Medical Center, I have the awesome job of getting to know all the new physicians who come to town, and I'm very honored today to introduce you all to our new ENT, Dr. David Montag, originally from Mars, Pennsylvania. So thanks for joining us today.
Hey, thank you. Thanks for having me.
It's always great to have someone who is originally from this area, who understands we get some snow, and you even like the snow, I think, right?
I do, and actually I like the cold too. I spent the last 5 years in Minnesota.
Man, so it's like a heat wave coming to Meadville, so that's pretty awesome.
Right.
So I know all about you, but tell everyone out there a little bit about you. I said you're from Mars, but tell us about your training, where you went to medical school, training, all of that kind of thing.
Okay. Yeah, so I was born and raised in Mars, Pennsylvania. After I graduated high school there at Mars High School, I went to Case Western Reserve in Cleveland, and I was a biomedical engineering major. And at that point, I didn't know if I wanted to do research or go into medical school. So I went to the University of Pittsburgh, and I got a master's in bioengineering.
Oh my gosh.
And my advisor there was a surgeon, and I was drawn to the medical field at that point. So I applied for medical school. I went to the University of Pittsburgh for medical school. And then I really liked ear, nose, and throat surgery when I was in medical school. So I went to residency at University of Minnesota for that. And that training was 5 years. The first year of that training is in general surgery, followed by 4 years of just ear, nose, and throat surgery.
That's very cool. Explain to people out there, because I think we hear an ENT, but sometimes don't realize that you're a surgeon as well. So tell us, what does an ENT do exactly?
Okay. Yeah, so the medical name for my specialty is otolaryngology.
Yeah, I wasn't going to try and say that. ENT.
But that's why most people just say ENT, short for ear, nose, and throat.
That's me.
So we are both the medical and the surgical specialists for all ear, nose, and throat problems. I would say 80 to 90% of patients could be treated just with medical treatment alone.
Okay.
So about 1 in 10 would need surgery if the medical treatment fails.
Okay. And we talked before we started here that you see a lot of children. So a lot of your pediatric patients come for ear tubes and for tonsils. Let's talk a little bit about that, because I think that's a lot of who your patients are going to be. How does a parent know when to come to you, and what services would they need from you?
Right. So one of the most common reasons that we do tonsillectomy, or remove a child's tonsils, is if they're having trouble sleeping at night. And snoring by itself is not a major problem, but if the child's having periods of apnea where they're not breathing or gasping in the middle of the night, and they have large tonsils and trouble breathing through their nose, that would be an indication maybe if we're doing a tonsillectomy and adenoidectomy.
Okay.
And then other reasons for doing a tonsillectomy would include lots of sore throats over the year, where they need lots of antibiotics, and I'm talking a lot, like 7 infections in 1 year.
Okay.
And it's less if it recurs every couple years, so 5 in 2 years or 3 in 3 years.
Okay. Because I had asked you, my son, and he's only 5 years old, so when he watches this years from now, we'll be mortified that I brought this up. But my 5-year-old snores and snores and snores, but you said that's not necessarily a problem. Parents should watch for the breathing to make sure that...
Right, to have the tonsils taken out, you would need to have apneas.
Okay.
But the snoring could be related to nasal congestion, and there's things we can do to help with nasal congestion as well with medical treatment.
So I guess I need to make an appointment.
Feel free, you could.
So congratulations are in order, because you just published another paper.
Yeah, thank you.
Tell us about that. What does that mean exactly, and what was your paper on?
Okay, so it's a small paper. I did a small study at the end of residency in Minnesota, and we saw lots of facial trauma patients at the county hospital. And if you have a deep wound of the face, particularly of the cheek, there's a chance you could cut the duct that drains your spit gland into your mouth.
Okay.
And if you don't recognize that at the time and you just close up the wound, you can have lots of complications like saliva leaking underneath and getting wound infections.
Oh, wow.
And sometimes it's hard to figure out if that duct has been cut or not. So I came up with a technique where you could diagnose if the duct has been cut just in the emergency department using readily available materials.
Wow.
You just put a little probe into the opening of the duct. There's fluorescent strips you can mix with salt water, and you inject the fluorescent dye through the duct.
Okay.
And you have a black light that you can put over it, and you can see if it glows. If it glows, then you know the duct's been cut.
How cool. That sounds like a science experiment.
Yeah.
That's really cool. And you said it's really neat too because this is the first paper that you've published being a practicing physician. So it even says Meetville Medical Center right
That's
on
right.
that.
That's correct.
That's very neat. So why did you decide to go into ENT, ear, nose, throat? I mean, you went through all this training and the engineering. Why ENT?
Yeah, so I was drawn to it first and foremost probably because of the personality of the people in ear, nose, and
Yeah.
throat. They all seem to be very friendly people and very nice, and I got along with them really well, so that was the first draw to it. But I also like doing the medical treatment and
Okay.
surgery as well. And I think our clinics are very interesting too because they're very hands-on and we can do lots of procedures in clinic. It makes clinic more interesting, and it's nice for the patients if you're able to do something in the clinic instead of having to go to the operating room.
Yeah. Well, we're thrilled to have you here. You're over at the Poplar Street building. You are taking new patients.
Right.
They can call the hospital number at 333-5000 and ask for Dr. David Montag. Do you know your actual extension number yet?
I think it's 3441.
Okay, so 333-3441
Right.
if you want to make an appointment. Let's go to just talking about you a little bit. You're married with 2 children. You came here with 1 child, and after just a short time, now you have your 2 little ones at home. And you enjoy biking, we understand.
That's right,
Even
yeah.
in the snow.
Yeah, I did that a few times in Minnesota. They actually plow the bike trails there.
That's crazy
Yeah.
to me. I mean, I'm not a biker, but being out in the snow trying to bike just sounds awful.
Yeah, if you have the right gear, I would wear snow pants and ski goggles and heavy gloves, and you can get some studs and mountain bike tires, and you can make it work.
So if people see you around town, they could say, yep, there's the new ENT. He's from
Right.
Minnesota.
Right.
So what do you think about Meetville so far? It's been a couple months that you've been here. What do you think?
I like it a lot. I wanted to come back to kind of a smaller town
Yeah.
since I grew up in that type of setting. It's been really nice. I've been able to find places to bike on the country roads.
Yeah.
I did some mountain biking around here. And we're close to family now, and that's been great.
It's-
Seeing them a lot more.
That's great, especially with 2 little ones. It's great to be back home.
Yeah.
So anything else you want to tell our viewers out there?
Well,
You're taking new patients.
we're
They should
taking
give
new
you a call.
patients. The problems that we treat, if you have hoarseness that's been long-standing, that's one of the things you can come in for. Frequent sinus infections. We talked about some of the tonsillectomy and ear tube indications. Even if you have any bumps that you feel in your neck that you're worried about, you can come in and I can evaluate those for you.
Great. Yeah, so even if you just have a question, you can come in and see you. You don't have to necessarily have had, issues for years and years and years. Just even a small question. It's always better to be checked rather than to take a chance.
Right.
Great. Well, thanks so much for being with us today. Welcome
thank
to
you.
you and your family. And again, if you see him around town, Dr. David Montag, our new ENT, please welcome him to the community. And you can call 333-5000 to get in for an appointment. Thanks so much.
All right, thanks for having me.